A record-breaking 150,000 cases of COVID-19 were reported in the U.S. in one day yesterday, and that increase is straining hospitals' resources. Doctors and nurses say that they don't have enough personal protective equipment, and some hospitals are running out of beds and staff. David Begnaud explains what leaders across the country are doing about it.
With cases and hospitalizations rising, Chicago is telling its residents to stay inside.
Do not have guests over. Avoid unnecessary travel and cancel your traditional Thanksgiving plans.
Dr. Benjamin Singer at Northwestern Memorial Hospital says the number of COVID hospitalizations in Chicago is fast approaching levels they haven't seen since the worst days back in April.
The pandemic is real, it's deadly, and we need strong cooperation within our communities.
Chicago, the nation's third largest city, is among the first to announce a stay-at-home advisory, and it probably won't be the last. In states across America, governors from both parties are sounding the alarm, given the silence from the White House. Listen to what they're saying.
The curve that we had flattened, right now, this curve is a straight line, and it is straight up.
We can't keep expecting the hospitals to meet the demand.
We're running out of time. And we're running out of options.
Limit your social gatherings to just those of your immediate household.
To the west now, California is the second state to record more than 1 million coronavirus cases. In Utah, all of that state's staffed ICU beds are now full. So the governor has called nearly 200 traveling nurses. And in North Dakota, they have just 9 ICU beds left statewide. 1 in every 83 residents tested positive this week. The system is so strained that the state's Republican governor issued an order clearing nurses who are infected with the virus to continue working with COVID patients as long as those nurses are asymptomatic. But the Nurses Association says they're asking the governor to implement a mask mandate first, but he just won't do it.
And the numbers are just much, much worse than we've ever seen before.
That's Dr. Ashish Shah, dean at Brown University's School of Public Health. He says with vaccines on the horizon, there is an end to this pandemic, and it's in sight. But the worst is far from over for us.
I understand the fatigue, but people really do have to pull it together. We're not talking about forever. We're just saying for the next couple of months. Those are the critical months.
You know, Dr. Shah also pointed to New York and California and said for the most part, they seem to have gotten control of how they're doing things moving forward in the pandemic, and other states should be looking at them for how to model what they do. Vlad and Anne-Marie, back to you.
All right, David, thank you very much. Dr. Bob Lahita is with us now to talk about these precautions and why cases are increasing so dramatically. Dr. Bob, daily COVID-19 cases are very high compared to last month. Explain the sharp increase and what needs to happen, in your opinion, to bring these numbers down.
Okay, Vlad, it's good to see you. The problem is this, that people are fatigued and tired of wearing masks and social distancing and washing hands. We see that with the various events, sporting events, weddings, where people are not wearing masks, hundreds of people gathering. It actually is a complete disregard for what we have been saying all along, and that is social distancing, wash your hands, behave as though the virus is radioactive, wear a mask. And this is really, really, really very basic. And if they do that, we will have control of this pandemic, particularly in those states which are hard hit right now.
You heard in David Begnaud's piece that North Dakota's governor has cleared nurses and other healthcare workers who are infected but are asymptomatic to continue working because of staff shortages. This sounds deeply concerning, and it sounds unsafe either way, with the staff shortage or if they get back to work. I want to get your take on this. Is this safe?
No, it's not safe. But, when you're dragged to the end of your rope, you have to do something. Now, they clearly, we see this in the Northeast as well. There are only so many intensivists and so many critical care beds and nurses that are available. So this is evidence that the mask protects us both ways. It protects you from me and me from you. So if they're wearing masks and protective equipment, and God forbid they should deal with regular uninfected patients, but they are going in presumptively and working with only those patients who are infected. Now, the unusual and crazy thing about this is that the governor has not mandated that everybody in the state wear masks. this should be the case. If you're going to have asymptomatic infected nurses and physicians presumptively working with patients, there should be a mask mandate for everybody, because hospitals are not only running out of PPE, but they're running out of capable caretakers. I mean, there are only so many, as I said, so many doctors and nurses that are trained to deal with severe COVID cases. And fortunately, in the Northeast where we are, it's not a problem yet, but it could be in the next few weeks.
It is so striking to me when we talk about these numbers, 240,000 plus Americans who have perished because of this coronavirus pandemic. And, I grew up like the two of you. I grew up in the wake of the Vietnam War, where we lost 58,000 servicemen and women, and how that scarred this country for so many years after that, where we talked about the lost flower of youth that had perished overseas. And in that case, people didn't have a choice. We still had conscription, and so people went and they fought and they died, and it really sort of put a scar across this country. And here we have 240,000 Americans who have died, and we can do something about it. We can individually protect our loved ones, our neighbors, our friends, our families, and we have been unable to do so. And now we're reading and learning that hospitals are running out of beds. So when that happens, doctor, when hospitals run out of bed and people keep getting sick, what can be done? What do you do when there isn't any room for them?
Well, we make room. Glad. I mean, we're very resourceful in healthcare and in public health. We have to make room for what we have. We can only do what we can do. We note that in our particular hospital, we created 3 to 4 additional intensive care units. We had intensive care units in the operating area, in the emergency room. They were everywhere. And then we brought nurses in from the outside. We were flying nurses in from Denver, Colorado. From Washington State, and now it's the reverse. We're going out there to work because they have shortages. So we only can do what we can do. And believe me, the problem is not just limited to the United States. It's a problem in Europe as well, Eastern Europe, Western Europe. They have shortages of staffing and doctors and nurses as well. And they have shortages, as we do, of intensive care unit beds. So this is a pervasive problem throughout the world, not just here.
The president of the European Society of Intensive Care Medicine came out and said that doctors should not use remdesivir, routinely anyways, on COVID-19 patients. He based that decision on a World Health Organization study that showed that it didn't have much benefit on patients. But there have been other studies saying that it shortens recovery time. And this whole conversation about remdesivir has gone back and forth, back and forth. What is your take on the drug? Is the drug effective or is it not? Is it effective for people who are, in their early stages of the illness, but perhaps less effective later on? What's your opinion?
My opinion is this, Anne-Marie, that the drug is effective. We're using it on inpatients. I have seen, and I make rounds every day on certain floors where we cohort the current COVID patients who are not in intensive care, and those patients are on at least 5 days of remdesivir, and it appears to be an effective drug in our hands. We also use other drugs like dexamethasone, and we use blood thinners as well to keep patients alive. But that's for hospitalized patients. The WHO has come out and said, and there's going to be a New England Journal paper, I understand, on this shortly, that remdesivir is not as effective as they would like. Well, we did away with hydroxychloroquine, which is useless. We did away with the other antivirals like ritonavir and letonavir. They're not helpful, but remdesivir does show, in our hands at least, in hospitalized patients, that it is effective, along with other drugs. Now, it may be that when a patient gets really sick and they develop acute respiratory distress syndrome and they are very hypoxic and have to be intubated, that remdesivir is not as effective then. But we have other means and measures which we use, such as anti-cytokine therapies, which are very, very potent drugs, monoclonal antibodies included, which will help to make our patients better. And by the fact, Anne-Marie, that we know how to use these drugs now, we're seeing tremendous decreases in the ICU-bedded patients and a tremendous decrease in those patients requiring ventilation and intubation. So I think it works.
And finally, Dr. Bob, the question on everyone's mind, we heard earlier this morning on CBS this morning. Dr. Fauci talking about his Thanksgiving plans. He says that he and his wife are going to have a quiet dinner at home. He's been saying that sort of throughout the course of this week as he's been doing interviews in anticipation of Thanksgiving, and then have a Zoom with his daughters. He wishes it weren't so, but that is the reality of the world that we're living in right now. But if someone wants to gather for Thanksgiving, what's the safest way to do it? I mean, there are clearly options if you can hold it outdoors, I guess, or wear a mask, or even better yet, have everyone tested and quarantined for 2 weeks leading up to it. But what is the best way for people to think about holding Thanksgiving?
Well, thanks, Vlad, for that. That's a very important question. Now, gatherings that we used to have with Aunt Mabel and Grandma and Grandpa, not a good thing at this particular time, because they may be at risk. The older you are, the more likely you are to be infected. So that's number one. Number two, if you're going to have a Thanksgiving dinner, have it with very few of your relatives. And I hate to say this, but you're going to have to be upfront and tell the relatives, if you're coming from another state where there are spikes, you're not welcome. And that's number two. And number three, ask them about symptoms. Have you had a fever? Have you been coughing? And they'll say, oh, it's my spring fever, it's my allergies. No, if you're coughing, you're not invited. And the other thing is, take a temperature of your guests. If you have 2 or 3 guests, maybe close family members, and make sure they're not febrile, which means having a fever. And be very, very careful, because we don't want your Thanksgiving dinner to be a disaster, as we've seen in the press with regard to weddings where hundreds of guests are infected because of no one wearing masks and being careless. You don't want that now. You don't want to kill off the rest of your relatives, although some people might want to do that because of a disgruntled relatives that they've had for years. But this is not the time to do that. Let's not use Thanksgiving as that excuse and COVID.
Right.
Yeah. Instead of having the awkward conversation at Thanksgiving dinner, just have it before. Get it out of the way. And
the question,
who knows?
The question, Anne-Marie and Dr. Bob, is when you've got siblings, who draws the short straw to have to tell the parents and the grandparents? Who's the elected one? Who wins that race?
You can't be embarrassed to tell the truth at this time. You can ask for forgiveness later, next year. Next year's Thanksgiving.
Exactly. That's when you say, I don't know, something's wrong with the Zoom. We don't seem to be connecting. All right. So this is very serious advice, though, that Dr. Bob Lahita is giving everyone out there. We're laughing because, you know, you can't always sort of cry about this sort of thing. But the advice is serious, and it's really good. There will be Thanksgiving next year, and we'll be all together, God willing. And
Zion.
And we can enjoy it next year.
That's right.
Yes. Dr. Bob Lahita, thank you so much.
Thank you.